So, from trade now to health, we are of another series in our reimagining the relationship between the UK and India. Now, part of the 2030 roadmap laid out between Prime Ministers Modi and Johnson included discussions and cooperation around health. In fact, I counted the words health, healthy, healthcare appear 37 times in the 2030 roadmap. So as we reimagine these relations, I am really delighted to host together in their first live interaction, the UK Secretary of State for Health, Right Honourable Sajid Javid. Thanks so much for coming along. How are you?
You're very good. Thanks for inviting me.
Good.
Looking forward to this.
Pleasure to have you. We've also really pleased to have joining us virtually Union Minister for Health and Family Welfare, Dr. Mansukh Mandaviya. Have we got you online?
Thank you.
How are you today?
Thank you.
There he is. How are you? Can you hear us?
Yes.
Great to have you. Well, I tell you what, let's dive straight in. Honourable Minister Mandaviya, let's start with the UK-India ties, shall we? UK and India are celebrating and marking 75 years of bilateral ties. I wonder what you think best demonstrates the enduring nature and significance of this relationship.
Thank you. Within the already ongoing war between India and UK with COVID-19 pandemic, healthcare and emergency crisis management has emerged as another important area of collaboration. The strength of India-UK partnership was demonstrated to the world by the highly successful collaboration on the AstraZeneca and Oxford University vaccine with the Serum Institute of India. The R&D capacities of AstraZeneca and Oxford coupled with the manufacturing capacity of SSII together created a global good which has saved many lives in the world. India, as one of the largest vaccine manufacturers, offered its manufacturing capacity to add availability of cost-effective vaccines, not just to the UK, but also to various low and middle-income countries. I'm happy to note that the third India-UK joint working groups of health was held recently, wherein topic issue of antimicrobial resistance, pharmaceutical cooperation, strengthening cooperation in human resources for health and digital health were discussed. India, UK have also agreed to closely work together to strengthen the global response to further health emergencies and working towards developing vaccines, therapeutics, and diagnostics. Recognizing technology as an enabler in health service delivery, India welcomes the collaboration between National Health Authority and National Health Services in digital health and associated technologies to solidify our collaboration in healthcare. India and UK can engage further on implementation of digital health solutions, joint health research initiative, technology transfer, and cost-effective manufacturing. Synergies between India and UK can ensure availability of affordable vaccines, drugs, and therapeutics to the world.
Thank you, Honourable Minister. So, Secretary of State, what would you add to that? Because it is really true, isn't it, that the cooperation between the Serum Institute, between Oxford, was one of the great moments within the pandemic. But what else would you add? What else do you think, as we celebrate, as we mark and reflect on 75 years of this relationship between the UK and India, what would you remark, what do you think demonstrates enduring nature or significance of the relationship?
Well, first off, thank you again for inviting me. It's great to be here with Mansukh and to see him as well. But I mean, first of all, before we even get to health, I think the relationship is incredibly strong. India is one of our oldest friends, and we have so much in common: a shared history, a shared culture, a shared language, and that shows in the relationship. I think our relationship has never been stronger. We saw that recently with the visit of Boris Johnson to India earlier this year. And also, if I could say, it matters to me personally. My father was born in India, and I love the country. In Punjab, just outside Amritsar, in a place called Jalandhar. And but it matters to me personally. India's got a special place in my heart, and it really matters to me to keep building that relationship. It's strong, but you can always keep building and working together. And then we saw that with healthcare, and Mansukh has just given a fantastic example of on the vaccines and cooperation. But we were able to help each other, and that's what good friends do. India helped us with vaccines, and that was fantastic. When India saw a big surge in cases, and we were able to respond immediately with PPE, with equipment and things like that. And that's what a good bilateral relationship is about.
Remember that
friends
moment.
help each other.
That was a scary moment.
Yeah, it was, and it was. But when it's a scary moment for India, it's scary for us because we care so much for each other, and we keep building on that. And so, for example, at the moment, India and the UK are doing a joint trial called the Recovery Trial, so linked to COVID on therapeutics, and we're working together on clinical trials, and it just shows you how we will keep doing that, working together.
Well, we've had COVID, but let's look at some of the emerging health threats, because the pandemic it's not over, but it's entering into a different phase in the UK. It's really drawn attention, hasn't it, to significant economic and societal costs of global health threats. So talk to me about how the UK and India are jointly approaching some of these other emerging threats.
Yeah, I mean, so first all of us saw through the pandemic just how a health issue can affect everything in your society. I mean, literally everything, and that was true for India, for us, and so many countries. We're all learning lessons for them to be better prepared for the next big threat. And some of those threats are actually very visible. We can, they're very clear. And at the top of the list, I'd put the antimicrobial resistance. And that is an area of huge cooperation between India and the UK. We both care about it deeply. Mansukh and I recently, when we met in Geneva at the World Health Assembly, that's one of our key things that we talked of. The UK is working with India on that, for example, through the Fleming Fund, supporting joint work, not just for antimicrobial resistance in humans, but also animal health as well, because we both value this, what we call the sort of One Health approach, and that is the sort of the silent pandemic. We can see it; it's happening. It's been going on in the background whilst we've been trying to deal with COVID, and we need to. The world needs to come together in that. But India's role in that is crucial, just given the sheer size and importance of India. But of course, the UK can play a big role in that, and we will. Also, we've got to look out for new potential zoonotic disease threats. So we have a joint program with India on zoonotic disease research.
What's that? What is a zoonotic disease?
Well, like COVID.
Okay.
So where the origin is from the animal world, and then it sort of jumps into the human world. And so we've got to look out for that, because we can see from COVID that no one knows when it will happen, but I think we have to be ready for the next pandemic. There's lots of reasons, climate change and demographics and things which suggest there will be another sort of new disease at some point, and we've got to be better prepared, whether it's with vaccines and therapeutics. And I think that relationship we've built up over COVID is going to be key in tackling that too.
Interesting. Honourable Minister, let's hear from your perspective from India about what emerging health threats you're focusing on. We've heard about some of the cooperation between the UK and India. What else would you add?
You see that COVID-19 has highlighted the need to focus on building resilient health systems capable of withdrawing emerging health threats, striving towards achieving universal health coverage, and to ensure accessibility, affordability, and availability of healthcare. India under the Honorable Prime Minister Narendra Modi ji has launched an overcharging approach through Ayushman Bharat with its four associated pillars. Under the Ayushman Bharat Health and Wellness Center, 150,000 health and wellness centers are being established to provide a preventive, promoting,
We're having a little delay in the line there.
and breath of the country. Second pillar of Prime Minister Jan Arogya Yojana provides health assurance to 500 million Indian citizens who are identified secondary and tertiary health services free of cost in a cashless and paperless manner, making it the biggest government funds health insurance scheme in the world. Through its pillar of Ayushman Bharat Health Infrastructure Mission, an outlay of 8.8 has been sanctioned to strengthen surveillance, create a network of integrated public health labs, infectious disease hospital and research network across the country to aid ongoing COVID-19 management and to manage any future health emergency. Fourth pillar of Ayushman Bharat Digital Mission, seamless intervenes these initiatives to create continuity of care and is working towards the establishment to digital health ecosystem for country. The present pandemic has highlighted two fault lines in the architecture. Beside working towards creating raw infrastructure in the country, India is also
Short delay in the line there. We'll see if we can get
response
it back.
and advocating use of technological tools as global public goods. India is also embracing the cause of distributed manufacturing of drugs, vaccines, and therapeutics, with specific focus on not only access but affordability as an approach to ensure equitable healthcare. India and UK need to collaborate on this aspect in the international forum.
Thank you
Yep.
very much, Honourable Minister. We've got a deep nodding of a head there. So another item on the agenda for your next meeting. Honourable Minister Mandaviya, let's stay with you for a moment. You know, you mentioned COVID-19, you mentioned the impact on the health infrastructure. It really highlighted the pandemic, the need for resilient health infrastructure at the national and also at the international level. So I wonder, when you look back now, what are the main lessons that you learned, that India learned, as your country leveraged augmented existing health infrastructure in order to effectively manage COVID-19?
Under the fronted leadership of Honorable Prime Minister Modi ji, India had adopted a proactive and graded approach while dealing with this once in the century crisis of COVID-19. We initiated surveillance at point of entry and we did it much before the declaration of public health emergency of international concern by WHO. Understanding the highly infectious natures of the disease, we created a dedicated infrastructure for management of COVID-19. Three categories of facilities dealing with mild, moderate, and severe patients were established as early as March 2020 from a single lab in January 2020 to 3,392 labs at present. We have now the capacity of conduct more than 2.5 million tests per day. India augmented domestic production of PPE kits and N95 masks and over 1,100 indigenous manufacturers of PPE kits were developed. India is presently the second largest exporter of PPE kits at 95 marks in the world. Union government supported states in India for rapid infrastructure augmentation through emergency COVID package with the outlay 1.9 billion and 3 billions. More than 200 technical advisories related with containment testing, clinical management, and multiple aspects of COVID management to aid COVID-19 response is issued. Capacity building of healthcare staff across the country was taken up through a network of national and state level centers of excellence, which organized cascaded training of medical fatality, of clinical management protocols. In fact, I can highlight it that it is a classic example of a whole of government and whole of society approach. So, needed in management of any pandemic which has been adopted successfully by India. It is with this strategic approach that India has been able to manage the spread of infection with currently 31,653 cases per million and 383 deaths per million,
Okay.
amongst the lowest in the world.
Okay, thank you so much, Dr. Mandaviya. We're going to come back to you, but time marches on. I wonder if you'd like to build on what you heard there, and particularly looking at this resilience of health infrastructure. It was shaken during COVID-19. When you look back, what are the lessons that you've learned?
Look, I think we've all learnt a lot, and one is that no one wants to see the response to a new pathogen that's like COVID in the future being lockdowns and all of that. I think everyone understands why that happened, trying to stop people from mixing in the normal way, but the way out of any future risk has got to be through pharmaceutical defences, and that requires, first of all, good data and surveillance, good science capability, to understand the pathogen, to be able to decode it quickly, to try and understand how it spreads. With COVID, there was quite a bit of information at the start, but it certainly wasn't all available as soon as it could be, and that's why I think the World Health Organization working on a new pandemic instrument, a legally binding instrument that will oblige all countries to share information early is going to be really important. That's a lesson learned. The other thing on pharmaceutical defenses was vaccines. We saw whether it was the Serum Institute in India, it was AstraZeneca here in the UK, also the mRNA technology from BioNTech, Pfizer, and Moderna. I think it's great, for example, in the UK, we're getting this big inward investment from Moderna. They're going to move their global R&D headquarters here to UK, do more clinical trials here in the UK. That helps build up future defenses, but also therapeutics. Both in India and the UK, we were quick early adopters of therapeutics. Here in the UK, we discovered how dexamethasone could be used, and that saved millions of lives. But alongside that is also the diagnostics. Look at how people today, in their home, can do a test for COVID, and that was unimaginable being able to test.
We all got used to that.
Yeah, we got used to that. And people accepted that and trying to sort of build on that for the future. So look, there's a lot there, but the important thing is the lessons of being learned. And in India and the UK working together, I think we can absolutely, I'm confident, we can be much better prepared for the next big threat.
Do you think we can do better on manufacturing locally where it's needed? That was one of the things, is getting the vaccines and getting trust in vaccines to places in Africa, for example, which we know the inequity continues even today, but part of that needs to be safe, effective manufacturing of vaccines, not just for COVID, but for everything, in more localized parts.
Yeah, and I think that is a lesson learned as well. We don't want to see, there were, I remember sort of at the start of the pandemic, a bit of what you would call vaccine nationalism and things, and you want to make sure everyone can get, as you say, fair, equitable access. I think some more manufacturing capability in different parts of the world is a very important component of that. But I think we mustn't just get drawn in too much into it's about manufacturing. It's about ultimately you want to it's no good manufacturing it if you can't get it into arms.
Yeah.
Right, and they're very different things.
Yeah.
And what we found actually just starting even a few months ago, we've got plenty of vaccine that we're trying to give to countries, and even when COVID was a bigger threat than it is today, but a lot of countries were ultimately turning it down, or it's just wasting away in warehouses because they didn't have the infrastructure, the logistics to get it into people's arms. Now, India could get it into people's arms, we could, but sadly there's many countries, particularly in Africa, that couldn't, and I think there's work to be done there as well.
Yeah, I think that's a really interesting one. Let's come back to the Honourable Minister Mandaviya in India. Tell us about communications, smartphones, televisions, 1.4 billion citizens in India. Talk about how you get information across to these people, especially as the pandemic progresses and as health issues change. How do you continue being able to speak to people quickly?
It is important part of our COVID management, community engagement through effective risk communications and awareness building on various aspects of COVID-19 management, including adherence of COVID-safe behavior, challenges related to vaccination hesitancy and vaccine eagerness was a critical element in winning the battle against COVID. Honorable Prime Minister spearheaded the efforts towards creating Jan Andolan, means people's movement, and Jan Bhagidari, means community participation, through regular interaction with community and all stakeholders. His personal affairs elicited a strong positive response from the masses, promoting behavior change and compliance to COVID-appropriate behaviors. Ministry of Health website provided authenticate information pertaining to travel advisory, SOP, guidelines on clinical management. It had over 220 million hits at peak during day, utilizing access of mobile and telephones. Caller tune messages in 13 regional languages, reaching more than 1.70 billion subscribers were disseminated. Identified network of medical professionals provided authenticate information through multiple medias, including in regional language to ally
Very different, isn't it? Yeah, I'm going to pause you there because we're running out of time. But
170 plus TV programs with total reach of 830 million views, 5,131 tweets on Ministry of Health and Family Welfare Official's Twitter handle.
Thank you. I'm going to pause you there, Minister. Minister, I'm sorry. I'm so sorry. I'm going to pause you right there.
140 YouTube videos were published, boosting myths, ensuring factual information, and dissemination of success were taken up through social media. 400 plus social media influencers were briefed to promote factually accurate information and boosting myths and misconception about the COVID-19 vaccine. 195 community radio networks and 150 private radio stations were engaged to create awareness, particularly in the remote and rural parts of the country.
Minister, can you hear me?
Our field staff, ANMs, ASHA, and frontliner workers disseminated information on the ground to reach the last mile. We leveraged print and electronic and social media for interaction with community besides regular press briefing at national, state, and district level on the regular basis. We thus had 360-degree approach for comprehensive risk communication to manage infodemic and alliance and misconception.
Minister, thank you so much. He had a message in there, didn't he, to get that message across. I want to talk to you about digital health. That issue around communication is obviously so important. But let's end on this issue around digital health, which has been absolutely fundamental, not only in managing the pandemic, but also in managing ongoing health systems concerns. So I wonder if you'd like to just reflect a little bit on what you've learned and what we can see from the future in digital health in the UK as well.
Well, actually, I mean, just yesterday I published a new digital health plan for the entire UK health system, looking out for the next 10 years. And a lot of the lessons we've drawn from the COVID experience. You know, COVID was a catalyst for change. For example, here in the UK, the NHS app, before the pandemic, I think there were 2 million users. Now there's over 28 million. It's 2/3 of the adult population. And they're still using it for, whether it's GP information, it's getting their own medical records and things. And we've announced that we're going to be adding a lot more functionality, including virtual appointments and things to that. And I think people welcome that because they've seen the difference that digital can make. But also, just on the information point, I completely agree with what Mansukh said. And one thing I just found, and we've had this in the UK and in India, but it wasn't in every country, which is having some political consensus, having politicians agree that vaccines work, they're a good thing, and that was the case in India, it was the case in the UK. It wasn't a sort of political dividing ground. In some countries, including the United States and others, that unfortunately became a bit of a political battleground, and that had a price to pay in terms of dealing with the pandemic.
And we've seen the number of people vaccinated as a result. It's quite good in the UK. Yeah. Interesting. So I think we're going to have to leave it there because we've run out of time. But I really want to thank you very much for your time, Secretary of State, and thank you as well, Honourable Minister Mandaviya in India. Let's give them a huge round of applause. Thank you.
Thank you.
Thank you.
Thank you so much.